Influenza is a nose and throat disease caused by viruses. More than 200 viruses have been found to cause the common cold. Another name for the disease is the common cold. The main viruses that cause the disease are rhinoviruses, coronaviruses, adenoviruses, and RSV. The disease is more common in autumn and winter. The incubation period of the disease is 24 to 72 hours. The duration of the common cold is usually about 1 week. In young children, this period may be longer. The cold is often confused with the flu. However, the common cold is a milder illness than the flu. The biggest difference between a cold and the flu is that the flu does not have a runny nose. The cold can occur at any age, from children to adults. Antibodies passed from the mother in the first 6 months protect the baby. In the later period, it is considered normal for a child to have 6 to 8 cold attacks per year. With the school period, the number increases as the child begins to be in more crowded environments. Adults may have 2 to 3 attacks per year. It is transmitted from person to person as a result of the scattering of nasal and throat secretions of people with colds through droplets. The main factors contributing to the increase of contagiousness are inadequate hygiene, insufficient hand washing, contact with the sick person's belongings, cleaning of toys in kindergartens, close contact with people who have a cold, smoking or being in smoking environments, insufficient sleep, weak immune system, crowded and poorly ventilated environments, public transport, places where people live collectively, such as kindergartens, schools, and nurseries. The main symptoms of the common cold are fever not too high, sore throat, burning in the throat, runny nose, stuffy nose, sneeze, dry cough, watering and burning sensation in the eyes, fullness in the ears, headache, weakness, and fatigue. There is no specific treatment for the common cold. If the patient does not develop sinusitis, bronchitis, or middle ear infection, antibiotics are not used. Disease symptoms usually last 10 days. However, if complications occur, the duration of the disease is prolonged. The general treatment principles are to reduce the patient's pain with painkillers and to ensure comfortable breathing with nasal depressants. It is useful to drink plenty of fluids during this process. Humidifying the room air allows the patient to breathe comfortably. The throat can be gargled. Some drugs used in the treatment of colds can be used when necessary. Herbal teas are also very useful for colds. It is important to consume plenty of fresh vegetables and fruits. Bed rest should be done as much as possible. Masks can be used to prevent contamination. Hand cleaning is very important in preventing the spread of the disease. What is good for cold? Mint and lemon, ginger honey, cinnamon honey milk, lemon linden, C vitamin, throat lozenges, echinacea tea, chicken and trotter soup. To avoid the common cold, it is necessary to pay attention to the following. Washing hands frequently. Not to touch the nose and eyes with hands. Ventilate the environment frequently. Not to smoke and not to be in smoking environments. Cleaning of toys in nurseries and nurseries. Don't forget to like the channel and subscribe.